Thank you all. Thank you all so much for including me today. This is just an incredible outpouring. It's amazing that to see this number here today around such an important issue. So just really pleased to be here. What I wanted to do is just give you a little taste of the Sacramento landscape. A few of the things that are going on in the legislature. Policy discussions that are going on, a few bills, and then also a few budget items that I wanted to bring to your attention. So some of you may be familiar with some of the work that's been going on over the last actually 3 or 4 years at the Commission on Teacher Credentialing. The statewide school mental health policy work group made recommendations. The Commission on Teacher Credentialing and the Department of Education have been really overhauling the standards for new teachers and administrators over the last 3 or 4 years. And in that overhaul, they've changed the standards and expectations for both teachers and administrators to embed social emotional learning, mental health, trauma, restorative practices, positive school climate, culturally responsive, implicit, explicit bias. So those things have all been occurring and were finally approved last June, a year ago in June, and are requirements of all new teacher preparation programs, or for every candidate going through a teacher administrator program for beginning on July 1 and thereafter. So that's really good news. It's something that a lot of the higher institutions of higher education, the faculty are really going to need to start embedding in their courses for new teachers and administrators, and hopefully that's also going to carry over to what are in school folks who've already received their credential, that's the type of professional development and training that our teachers, even existing teachers, need those, and administrators need that training as well. A few bills that are on the docket. I put 5 on the slides, but I want to talk about 6. We're currently in the legislative year where the bills are just still moving through their first policy hearings. And have not been out of their house of origin. But one of the bills that I wanted to draw your attention to is AB 89 by Assemblymember Mark Levine. This requires all licensed psychologists to have obtained a minimum of 6 hours of education or training in suicide risk assessment and intervention. The governor vetoed similar legislation last year, or actually it was 2014, but that included all licensed mental health professionals, family therapists, clinical workers, and counselors. This year that's focused more on licensed psychologists and has really received a lot more support, bipartisan support in the legislature, and it's currently on the assembly floor. AB 254 by Assemblyman Thurman requires the Department of Health Care Services, in cooperation with the State Department of Education, to establish an LEA, a local educational agency pilot, for the purposes of improving mental health outcomes of students through a whole person care approach. The goal is to provide school districts the funding needed to both expand services, or to expand services for physical and mental health, for both physical and mental health. AB 254 requires Department of Healthcare Services to encourage participation in a pilot program, provide technical assistance, and support in identifying public and private funding sources that will assist LEAs in enrolling students in the Medi-Cal program. That bill has been double referred and is in the Assembly Health Committee. The hearing is tomorrow at 1:30, and it will be heard in the Assembly Education Committee a week from Wednesday on the 26th, provided it passes on tomorrow in Assembly Health. The third bill that I wanted to draw your attention to is AB 834 by Assemblyman O'Donnell, and it establishes an Office of School-Based Health Programs within the Department of Education to administer and support school-based health programs operated by public schools. Requires that the Department of Education establish the Office of School-Based Health Programs to administer current health-related programs under their purview, to advise on issues related to the delivery of school-based Medi-Cal services in the state, and also to develop recommendations for an interagency agreement, or MOU, between the Department of Healthcare Services and the Department of Education. And it also asked that office to assist the Department of Health Services in formulating the Medi-Cal state plan amendments. And that bill has been double referred. It actually unanimously passed the Education Committee, and it will be heard in the Assembly Health Committee tomorrow. Assemblymember Dr. Weber has AB 1029, deals with comprehensive school safety plans. If there's one thing that we've found on the schools, the SARBs, the attendance review boards, you really need to have a mental health professional who's involved and participates on that. And this relates to the comprehensive school safety plan. So AB 1029 revises the composition of the planning committee and seeks to ensure that there's at least one or more individual with expertise in social and emotional health issues of the children and youth, including but not limited to restorative justice practices, community school coordinators, or mental health professionals. So really it's trying to make sure that those experts are at the table and that you as experts are at the table when those plans are being developed. That bill's in the Assembly Education, or actually passed the Assembly Education Committee 6-0 with one abstention, and it's currently in the Appropriations Committee. Some of these bills get caught up in the Appropriations Committee because of the cost, so it is important to be advocating and to weigh in to make sure that the members of the legislature know how important these bills are. They may pass the Policy Committee unanimously, but they don't move out of the Appropriations Committee because of the fiscal impact, and we want to make sure that those keep moving. So make your support known. SB 191 by Senator Bell seeks to create a demonstration partnership between school districts and LEAs and county mental health plans, or providers in the county mental health plan network, to provide universal mental health and substance use supports, assessments, and services. Partnerships would leverage school and community resources to offer comprehensive multi-tiered interventions on a sustainable basis, and also to address coordination of services and referrals through a coordination of service teams. It also establishes a county and local educational agency partnership fund. So this would actually be establishing a fund statutorily with the intent that that would be actually funded by the budget and could provide support for these partnerships. And that bill passed the Senate and Assembly Education Committees unanimously, and it's currently in the Senate Appropriations Committee, where it will be heard on the 24th. Finally, I want to bring your attention to one more. As Assemblymember Berman has AB 1261, and 1261 it makes changes to the provisions related to the expulsion for students in possession of or under the influence of controlled substance or alcohol. Currently, students could be expelled for possession or use of controlled or alcohol substances. This requires school officials to consider whether the pupil has risk factors for suicide, including but not limited to substance use disorders, mental illness, medical conditions, and disabilities, self-harm, or attempted suicide, and requires school officials to consider whether the pupil should meet with a school-employed mental health professional prior to suspension. That bill is actually on the Assembly Education Committee and will be heard next Wednesday. So a lot of bills being heard next Wednesday. On the budget front, there's a number of things. The legislature has really invested in the multi-tiered systems of support, and through the Proposition 47, which is the early release of nonviolent offenders, they've established a program that can be used for really to address trauma, mental health, reduce chronic absenteeism, reduce suspensions, and address restorative practices. and that's Proposition 47. And then the multi-tiered systems of support, the legislature has invested $30 million to the Orange County Office of Education, and they're currently in the process of distributing sub-grants to school districts and have just gone through the first RFA process. All districts should be able to apply for that. They'll run it 3 cohorts. So hopefully folks are applying for those funds. But on the budget front, we need to continue to fund those resources. So on the 25th, one of the most important budget hearings of the year for multi-tiered systems of support, Proposition 47 and also Proposition 56, which we can hopefully use some of the tobacco use and prevention funds to support things like multi-tiered systems of support and school climate surveys. That's an opportunity for folks to show up and tell them how important it is to fund those programs. Children Now, we're doing a joint letter organizations can sign on that we're going to be wrapping up on Wednesday. But if folks are interested, email me. I'll have cards over here, and you can add on to the joint letter to urge the budget subcommittee to fully fund multi-tiered systems of support and Proposition 47 for those prevention practices. Thank you.